first, I would like to introduce Dr. Robert Listernick, and he is from Lurie Children's Hospital in Chicago. Dr. Karin Walsh is from the Children's National Hospital in Washington. Katie Phillips, right here from the city. She is the mother and volunteer extraordinaire for NF Complaints, and we'll be sharing. And Dr. Christy Canty, right here from our own Kansas City Children's Mercy Hospital. And let's welcome all of our distinguished guests here.
Yes, that's the slides. All right. So I was asked to lead this discussion, and I thought I would start off with just two illustrative cases. And I think we're getting the slides up now. Thank you. Really briefly. Okay, there we go. So the first case is a 13-year-old girl who has who had multiple cafe lay spots, was diagnosed as having NF1. She was found to have bilateral optic nerve tumors that I'll talk about later. And for the first several years, her parents took her to two separate NF clinics because of their anxiety over the diagnosis and what could possibly happen. Around 5 years of age, she developed a progressive tumor that required treatment. At 8 years of age, she was found to have some cardiac problems that might or may not be related to NF1. And then throughout this time, the mother's response was, what can happen next? What's the worst that can happen? And then about at age 11, the child began working out 7 days a week, running, using weightlifting, eating a low carb diet, constantly talking about foods, reading labels, and requesting nutrition, even requesting nutrition information on croutons in the salad. And so you can see this is her growth chart. For those that don't know about growth charts, so this is her weight, and her weight began falling off, even her length began falling off. And she was diagnosed with ARFID, which is avoidant restricted food intake disorder. It's a separate, it's not anorexia or bulimia, it's more of an anxiety-related eating disorder. The second case is a physician father who brought his 2-year-old girl, daughter, for evaluation of spots, and we diagnosed NF1. Immediately, the father laid out ground rules. We cannot mention the term neurofibromatosis, and he told his daughter each year she was coming to college, not to a hospital. And then around 6 years of age, two things happened at the same visit. On entering the hospital, the girl was a smart girl, and she said, "Why are we coming to the hospital?" Because we had Children's Memorial Hospital written right in the front. And then during the visit, a resident inadvertently used the word NF1. The father took her, stormed out, and secondhand information tells me that she psychologically did not do well as she got older. I don't know if the two are related, but I wanted to bring up that case. So I'll throw it open to discussion. I mean, it's your questions. I have questions that I can ask our panel, but I'd love to hear what you guys say. Maybe I'll just start it off by saying, how do we talk to our kids with the NF1? How do we disclose the diagnosis? I'll start with Dr. Walsh.
I was actually going to let you start.
Oh, that's great. That's wonderful.
I definitely have things to say, but
I know you do.
start.
You
I can say from my experience as a parent, I have tried to make it very age appropriate and maturity appropriate.
Exactly what I said.
Yeah, so my son was diagnosed fairly young. And so he's grown up coming to these different events and knowing that he's got great supportive family, but also great supportive people from this community. And so for him, it's just, it's not something that he thinks about it, but it's not something that is sort of dragging him down. He gets excited about it and he likes to learn more about it. And so we just kind of disclose things as they come up, as his body changes, as he starts to ask questions.
Great. I think you guys want to say something?
I completely agree. I think looking at how the child is, what age group you're dealing with, And, establishing kind of the routine that you kind of talked about, like, we're going to go to the doctor and you talk about that. And then the physician, I try, depending on the age of the patient, involve the patients in the conversation as well. So I think it can be challenging when you have a family that doesn't want to acknowledge that there's something going on there.
Maybe we'll get to the second question later. I say you come into the spot doctor when you're 5 years old, and then,
Yeah, absolutely.
both, NF Network has brochures for teenagers when they're getting to read with, I always say, read with your parent initially and call us if you have questions. Dr. Walsh.
Yeah, I mean, I think one thing is it's not a one-time conversation, to your point, in terms of the developmental nature of things. And I also think and maybe this is a little going into the second part, but as a clinician, I do need to meet parents and families where they are at the moment. I just had a family who has a 14-year-old who they haven't told. The 14-year-old knows. So I can say that kids actually pick up on a lot more than we give them credit for. And so that becomes an interesting dynamic of thinking your child doesn't know something when they kind of think they do, but you're not acknowledging. So it's this weird space to be in. And I think then there's some trust things that can arise, right? But I get the fear of sharing it too, right? To me, you have to think about transition planning, even from 12 and up, and empowering. To me, it's an issue of helping empower that child in knowing themselves to a point they can self-advocate, they can make their own plans for their future in a way that works for them. So, but it's certainly not an easy topic. I'm sure it's every year you're probably trying to figure out what to say, what not to say, but they'll go look themselves too if we don't share with them. And then again, you may be in a circumstance of seeing things that are much scarier than they needed to be. So it's not an easy topic.
And I think when you look at the studies, they say that your child wants to look at you as an expert. They want to have you as really kind of be able to have that trusted source to ask those questions that come up. And in the beginning, it really might not be anything, but it could be when I'm going to kindergarten, people are picking up on my brown spots. What does this mean? What do I tell them? And then I always say, like, arm your kids, like give them phrases and words and things that you can do to help them kind of deflect, say, yes, I have, NF, and it's a part of me, just like you have blonde hair and blue eyes, and you're not going to catch it. Hey, let's go play. And so giving those things to them and having them practice those skills over and over can be really helpful.
I have plenty of questions. That's why I'm looking at my phone that Sharon sent me some, but please raise your hand and but I'll keep going until somebody raises their hand. How about family members? This is another thing that I clearly see come a lot. How do you disclose it? One to the siblings is one, and the other is to cousins, teachers. Because I'll just say that I've had parents go both ways. They feel their kid is going to be stigmatized if they say they have NF as somebody who just has some spots and nothing else. For others, it opens the door to resources that you might not get otherwise. So I'll start with Kami again. How do you balance that stuff?
Yeah, so I definitely get that perspective. You don't want to be that parent that's going in there and saying, try to make exceptions for my kid because this isn't this. But at the same time, you have to find that balance in doing that, because you do want to be your child's advocate. You want them to get the necessary resources that they need. If they're struggling in school, you don't want them to just continue struggling. And so a lot of the districts will talk about early intervention and how vital that is to try and get that support early, and don't let them take that away from you. And I think if you're in that position with the school district and you are modeling that sort of behavior for your child, they do learn to self-advocate for themselves, and they kind of follow your lead in that perspective. So yeah, we've had really good, experiences with our school district. And from a family perspective, I have a younger child who does not have NF, and he has similarly grown up. He again also enjoys going to all the events, and he loves to wear the shirts, and he loves to ask just as many questions as my older child does. And so it's been for us, I don't want to say simple from that perspective, but we have a lot of support from that family.
I'll just say that, I'm going to show my age in terms of the school. I sort of feel sometimes I tell parents, you have to be like Khrushchev at the UN, taking your shoe off and banging it on the table to get what you need. So you do have to advocate for your child, but you also don't want to disagree. You guys, Karin?
Yeah, schools often struggle to understand one, and they see it as a completely separate thing from any of the maybe learning challenges that kids have or the attention issues that they might have. And I think, you know, we try to do a lot of work of educating the schools and teachers and being supportive, because it's not always that simple, and there can be multiple things affecting that child's, you know, ability to get through the day successfully and feel good about themselves. And I do think that's NF related. You know, ADHD or learning disabilities aren't only for, you know, people with NF, but there's more of a constellation of things that I think can sort of impact, you know, if we're just addressing ADHD, we're not hitting all the marks, because there could be anxiety or other social related kinds of things that are also playing a part in the day-to-day. I was going to just mention real quick that one other thing that parents sometimes come to me with concerns is that they, in terms of sharing NF1, is that they don't want that to be an excuse for their child, which is an interesting thing for me as a neuropsychologist. I'm like, oh, okay. But that's a worry.
An excuse for what?
That maybe the child would say, well, I can't do that because
I haven't come across that. If you,
I get that actually fairly frequently.
I was gonna say, I think we are some of those parents who very much are, you know, like, yes, you have this, but it isn't an excuse, right? But also finding the resources and being an advocate for her at school. We did have to struggle. We did have to bang our shoe on the table, just like you explained, to get her on an IEP and to get her the help she needs. And our new concern, so my question is, you know, when she's gonna be a senior next year in high school, we're moving on to the college phase, and the school district has been great. Took a minute to get there, but they've been great since we got there in supporting her, and her teachers have been wonderful. And she is a good student, a very good student, but she does run into challenges, and we worry about college. When we get there, we know the colleges will follow whatever the IEP says, and we plan to keep her on that so she gets those resources. But we also know how much extra help she gets at high school and from us, and what is that going to look like during the college years. We know it won't be the same, but it is a concern.
well, I'll just start off by saying that this is a common concern that I have with parents, and you know, finding the right college is really important. And for somebody like that, there are so many small colleges where they really cater to students who need some extra help. Going to a place like, don't get offended, Ohio State, which is 40,000, that may not be the right place for somebody who needs some more handholding or special attention. So it's really important. And a lot of our families have found these niche colleges that have really been great for their kids.
I think to go a long way, she was saying, you know, when you were saying not to use it as an excuse, and it's not that we didn't want her to, so I'm just really trying to share from like maybe other parents' perspectives. So it's not necessarily like we didn't want her to feel that weight and to feel the pressure of this, you have NF, you can't do that. We would say, you can't use that as an excuse, let's go at it differently. So that's kind of maybe why parents would then worry about using it as an excuse. We just didn't want her to be put into this box because the NF box is so weird and different for everybody.
And I mean, part of the talk I'm going to do in a little bit later this morning has to do with sort of what people sometimes call growth mindset or resiliency. And really a lot of parents do more of what you've done, which is actually a good job at that, of not having, you know, helping their kids not define themselves by that or put themselves into that space. So it is interesting.
Yes, sir.
Yeah, just to piggyback on that, growing up, I grew up with severe scoliosis on top of neurofibromatosis, and my mom right here, she instilled on me like early, she never let me use my disability as an excuse. But because of that, it makes me real stubborn because I can't tell me anything. Like, I tell me one thing and I just do what I want to do. And it might be, but sometimes I do overdo it. But it's really helped me growing up now because like I'm 37 and the doctors didn't think I was going to live to see the age of 8 and I'm still here. And it just made me curb just instilling that like no excuse like at an early age. It really just made me more resilient and just I've been able to like accomplished like a lot throughout my life, but
That's great.
I thank her a lot because she never let me use it. I used to hate it because she was always hard on me and not but because I was the one who had the most growing up, she was like a lot harder on me, and like I thank her for it now because like it just made me who I am now.
Great job, Mom.
Absolutely. Yes, ma'am.
I'm gonna help go off with the IEP. I had NF1, I had an IEP in school. I have my bachelor's in education, elementary education, and a master's in administration and teacher leadership. Make sure that your IEP does not expire while she's in college. Very much advocate to get that IEP updated before she turns 18 or before she graduates from high school, and make sure that because once she leaves high school, you'll have to pay for an IEP update on your own, and it can become very, very expensive. But if she gets an IEP updated before she leaves high school, it has to follow her all the way through college.
Just with her team that we work with now.
Yep, make sure that they they reevaluate her before she leaves high school. Because they made sure that I got reevaluated before I left high school. So they did it the spring of my senior year, because otherwise it would have expired like my freshman year in college. And they made sure that I would have, and they were very afraid that I would no longer qualify for services. And I skimmed by with like the skin of my teeth. And I had services all throughout college. Notes were taken for me, textbooks I could get all online or all read to me. I could get extended time on all of my tests, including like my praxis, some of those very high state tests. So yeah, make sure that you advocate for that.
More questions?
I've got one.
Yes.
Right here. How do you, lack for a better term, justify to an older sibling how much attention you have devoted to NF? They often say everything is always about my sibling.
I'll just say that's absolutely true in any chronic disease. I mean, I do a lot of different things in pediatrics, and there's no question. I've seen families break apart because of the attention one parent, or for that matter, both parents pay to the one. So I think you need to give the other child, if not equal attention, significant attention and their own time, and deal with it as a family, not just isolating the child with NF1 and spending all the time with them. Karin?
I mean, one of the things I always work with, and I work with non-NF patients with pediatric with brain tumor, and this comes up also certainly in that
Sure.
world, is I definitely spend time on the family unit. And I often am asking parents how they're doing with all of this, right? Because, and acknowledging that everybody in the family might need something a little different, and being like saying, okay, because I think there's an expectation we can also, everybody can support each other in the same way. And that's not always the case. And I think just that acknowledgement, but then, you know, within the oncology world, there are sibling groups specifically for this topic.
Right.
Super sibs was, you know, now not everybody has it because it's something that has to sort of be funded at different hospitals. But that was specifically for children, for siblings of kids with, you know, brain tumors, and acknowledging that like this is hard, right? No matter what age of the sibling is. And this kind of attention piece is a big theme, I think, that many families struggle with in terms of finding some balance.
I'm going to take the prerogative, and I know that you have a question, but what about the second? And this is for all the providers in the room. I sort of failed those two examples that I gave. I think I'm doing better with example one, but what is our responsibility? How did I mean, should I have intervened with the father, even though we tried to get him to say it? I mean, I failed. You guys, yeah, Karin.
So in my role in my clinic, I spend a lot of time with our new patients the first time they come to see us. And this does come up where caregivers have a fear about using the name and what is entailed with the name, and what a doctor or a healthcare provider is going to say about NF if we're speaking openly during an appointment. And we're lucky in that we try to touch base with every family by phone before they come in person. to see us so that we have a sense about what's going on. And I have parents that tell me, we haven't told them yet. And we're concerned about that. We don't want to use the name. And sometimes these children are 10 or 12 or 14 years old. Sometimes they've been going to doctors and getting MRIs done and they don't know why. And I try to have a discussion saying, you know, we like to be open in our clinic about using the name and always speaking in a way that's age appropriate to your child in front of them. And that there's been research that has shown that it's beneficial to be open about these things at a younger age. And that many, in my experience, children are more worried that they're sicker than they are if we're secretive about it. And so I've actually coached parents about, this is what we want to talk about given how old your child is. And I've even offered to, do you want me to start the conversation when they come in to see us? And have been able to have discussion, and many times it goes over a lot easier than a parent thinks it will. Because you have in your mind all the fear about all the possibilities from your perspective as an adult, and all that you know about NF, versus your child that knows their own experience only. And unless they're a teenager and Googling things, if they're a younger child, they don't have the same access to information that we as adults. So we try to be very open in our clinic about those things.
Other comments?
I was
Yeah.
going to say, I think involving too, I agree with the literature. And then I think that involving your child early on also helps them learn to be empowered and teaches them to be their own advocate throughout the whole medical system, which can be really challenging. And so I think starting it off at a younger age is really going to benefit them as they become a teen and they transition into adult care.
Agreed. Yeah.
To your point, you're talking about the dad who really didn't want to learn. And the way I've approached that myself, because I certainly have this conversation many times with families where they're trying to hide it. And I just explained to families that having had the blessing of watch so many children grow up with NF, I find that the children who do just do much better when they are able to they come to the patient advocacy organizations, they're able to talk openly with it. I often get the children who didn't learn about it when they were a child, but then as an adult learn about it, there's a lot of anger towards the parents, you know, at that particular time. So that helps me sometimes if I can just talk to the parent, you know, to help them understand what the significance will be if they don't choose to talk openly with their child. And then we were talking about siblings before. I think that's where the patient advocacy groups really can help. It certainly has, you know, in our family, when you have the siblings come and then they can see that, well, there's NF in other families, right? And they're also dealing with the doctor's appointments, and even things like we would do Halloween parties with the kids, and so it just became more common, and the kids got to see that they weren't the children that don't have NF got to see, well, their lives were just the same. You know, the other children in the other family like to play baseball as well. And it just became more normal. So I think the patient advocacy groups getting involved in the activities like the walk that's coming up pretty soon, it's just sort of a natural thing that happens.
Well, let me put a shameless plug in then for you. I've had families where I try to get them to go to the camps and they don't want to do it because their child has very minimal manifestations. And how do you talk to them about that? Or how do you guys talk to them about that?
For me, it's pretty easy, right? Because I've been able to watch so many kids go through camp and watch the relationships that they build. And so I've just been able to explain that to them. You don't, as a parent that's not affected with NF, and then you see these kids develop these great bonds that last a lifetime when they go through these camps. And then they have people that they can talk to that are dealing with the same things they're dealing with. Especially when we're talking about family planning, that's where those conversations really happen. They happen at camp, you know, when these kids start to talk about things at camp. Yeah. So I think just being able to explain again the success stories that the kids have had. I've also had a parent send their child to camp without telling them
that they had NF because figured the camp was gonna take care of that. Camp was gonna do that. So it is a conversation that we just have to keep showing the positive things that we've experienced, you know, during our NF journey and share that with new parents so that they have the opportunity to do that for their families as well.
Other comments, Karin?
Oh, sorry. I like the positive too, because I've seen some of my patients do pretty remarkable things in terms of, again, taking control of their life, right? And how they want that to look and what the narrative is around them. And I always remember one kiddo who was in late elementary school and his friends had questions about his spots and different things. And he really took on to the CTF sort of, you know, superhero theme.
Yeah.
And he did a PowerPoint presentation to his class, decided he was going to tell his story, that other people were not going to tell the story for him. And it was like, I almost cried. Like, it was the most remarkable thing. Now, not every kid is that kid. So that's not the right way for everybody. You know, some kids really would rather compartmentalize that and not be defined by NF1. And that's okay too. And some kids really take on and want to be involved and want to speak up and you know, speak up for others too. So I think it's all an individual thing, but I've just seen some really remarkable kids that decide they're going to be in control and others aren't going to tell them how it's going to go. And it's been very positive.
Yeah, whether it's neurofibromatosis or cancer, or, you know, I feel like when a family doesn't want to use certain words or doesn't want to divulge certain information, I feel like there's always a reason why, and there's something underlying it. And I feel like as a provider, getting to the root of the concern, I think we can get combative about, you know, we need to say this or we need to do this, but there's almost always a specific reason of what they envision for their child or what they're concerned about. And I feel like we can often, sometimes it's very complex and sometimes there's a lot of things underlying it, but I feel like really getting to the heart of the reason of why is sometimes is helpful.
Yes.
Just speaking from experience back to what Ann said about your child being more nervous if they don't have information. When we took our daughter Alana to the doctor the first time, I had many questions for the doctor, and I told the doctor that I wanted Alana to leave the room so I could talk to him about the questions. And as far as a provider saying
that's a terrible, you know, well, automatically that means something's wrong.
yes,
You're hiding things that
yes,
in any circumstance
yes.
or almost any circumstance, that's the wrong thing.
Yes, and from the provider's perspective, he absolutely told me, no, she is going to be in the room for any of your questions, and I'm not taking her out of the room. So she will be much more nervous if you take her out of the room. So I do encourage parents to talk to their parents, to their provider in front of their child, depending on the age and what's appropriate. There are limitations, but I would not advise to have your child leave the room. The other thing I want to do a plug. These two, this is a book called the NF Buddies that the NF Network puts out. It's a wonderful, wonderful book written for children to explain to them that maybe they're a little different. Maybe they have spots. Maybe they go to the doctor more. But you'll see that the pictures are very child friendly. They're all with kids and we have them available. There's some outside at the table. And we've had luck giving these to teachers. Some of the teachers have read them in the classroom and it just makes it not as scary. It's been a wonderful resource. We'd be happy to provide those to anyone who wants them. We also have a version in Spanish if anyone would like that in Spanish as well.
You have an online question, you said?
There's two of them. The first one, what language do you suggest for a tween sibling to use with peers who ask about his brother's disability? He is in a more self-conscious phase than a protective phase.
I wonder whether she means the siblings to protect.
I think so, yes. Ask the brother what he wants.
Yeah, perfect.
Asking kids, by the way, is your best bet because they have a lot of good ideas that nobody asks about.
That's a good point. I think sometimes as adults, we tend to overthink how we want to respond to something. And you might ask the kid and they're gonna be like, oh, well, this is my basic answer. And the other kid's gonna say, okay.
But what's interesting, I literally this week had a 24-year-old young woman who I've been following since she was 1. Yeah, I'm old. And the father, both parents, but particularly the father, has really embraced NF. They have their own charity event, a race every year, and he donates to the hospital. And the young woman, for the first time, and this unfortunately, because I don't see adults, we're going to discharge her from the clinic, and she had complications. She said, you know, I don't want to be defined by the NF1. She almost resented the role that her father took, being really embracing it all. We really have to listen, and what Dr. Walsh keeps wisely saying, Dr. Kennedy, listening to our kids. I mean, she benefited from all that, but really, she really resented it in some way. Everybody's different.
And I think the dad can still do that, but she can be
Right.
released from that, right? It doesn't have
Exactly.
to be all one
Exactly.
approach.
I also think from talking to your kiddos, keeping it simple. Like a lot of them, we have all this information and we can give them so much information, but sometimes they just want a simple, very simple answer. And I think letting them lead that discussion, letting them kind of drive those questions, giving those simple answers, and that might be fine. And they might be able to go about their day, or they might have more questions. And so I don't think we have to divulge all this information. I think that tends to evolve over the course of time.
Great.
There's
Last question.
one more in line here. Do you have any tips for tempering child's anxiety as they get older and learn about complications that they could experience?
That they could experience. I gotta say, I don't want to be the harbinger of disaster. I try and, look on the good side and say, most people don't have this. Most people with NF don't have a big brain tumor that needs treatment. Most people with NF don't have scoliosis. One of the things I learned mid-career, early on, from Dr. Riccardi, who was, for those who don't know, the maven, the grand old man of NF1, is to talk about milestones. And an example of a milestone is optic pathway tumors that I'll talk about later on. Don't really start out of nowhere after the child's 8 or 9. So once you're 8 or 9, you don't have it, you don't have to worry about it. If there's no evidence of scoliosis when you're 11, 12, going through puberty, you don't have to worry about it. Plexiform, a big one, plexiform neurofibromas, at least on the outside. If I don't see any evidence of it by 2 or 2.5, you don't have to worry about it. So I'm trying to accentuate the positives in those.
I think that's a great point too, is just always, as a parent, I have a kid with a different chronic disease. And you gotta always take what you can control and turn it into a positive.
Yeah, absolutely. Last.
And I do think to some degree, we talked about having kids in the room and being a part of the conversations, and I do think that should be the default. But when I meet families, I do try to get a feel and maybe even ask them directly, what is the level of medical, if it's an older kid, do you want to be a part of these conversations? How much medical information do you want? I think it's okay to have conversations with kids outside the room as long as it's in the spirit of this is what the child wants. You let them know you're not withholding information. But to some degree, I try to get a feel for what level of information they want, so that anxiety can maybe be tailored to them.
Let me ask a follow-up question, if I may. You're an oncologist. By default, everybody's coming to you has some form of cancer.
Right.
Do you ever let a parent get away with not telling anybody over, pick an arbitrary age, that they don't have either a brain tumor or?
No, and I think it really is about the relationship, and it's about helping them come to the conclusion that that's the right thing to do. It's often about having them have a conversation with their child, because their child probably knows everything already. But that it's always a challenge, and sometimes it takes time to really help them arrive at that conclusion. But absolutely, it's not acceptable to completely not use words or withhold.
I just had a comment, just in regards to, I think also, help the kids understand that no matter what comes, it might be scoliosis, or it might be a large, it might be a large tumor. Those things could happen, but if they do, we're right here to help you deal with that. And we're going to help you get through it, whatever it is. So even if it is something like that, it's okay because we're all going to get through it together.